Welcome back. I'm your healthcare advocate, Cary Hall. You're listening to America's Healthcare Advocate Show, broadcasting here on the HIA Radio Network, coast to coast across the USA. My producer, Mr. Steve Largent, joining me again in this segment, Dr. Dawnavan Davis, Director of Healthcare Promotions for Blue Cross and Blue Shield of Kansas City. We are broadcasting from the Chiefs Sports Lab, powered by Blue KC. Now, I got this wrong, so I'm going to correct it. Go to the website, goarrowhead.com. I left the go out, goarrowhead.com. 37,000 children have been through this facility, and you heard Chiefs President Mark Dawnavan say, they show you some things we're not even going to tell you about today, some of the places they take you in the stadium that not everybody gets to see. So if you want to arrange a tour, it's a great opportunity. The Sports Lab is an amazing place with a lot of interactive opportunities for children. The website, goarrowhead.com, goarrowhead.com. Click on tours, and you can get your school, your YMCA, your Boys Club, Girls Club, Sedalia, Trenton, St. Joe, Clinton, Harrisonville, all the communities that listen to this broadcast around Kansas City, and all of you in Kansas City, goarrowhead.com. That's the website. All right. Now I get to ask you, tell us about yourself, Dr. Davis, and how did you get into this, your background and experience? This is a little different.
Yeah, absolutely. So I am a medical psychologist by training and did a lot of my work over the last 15 years in childhood obesity prevention research. And so before joining, had led efforts in the Chicago area to develop community-based programs related to childhood obesity prevention and treatment. And so have a lot of experience working with kids and families related to encouraging healthy lifestyles and behavior change related to physical activity and nutrition. And so I think what was appealing to me about coming to Blue KC is really this deep commitment to addressing childhood obesity and in an innovative way. And so not just thinking about programming, but also thinking about outreach and how those two pieces might come together to address some of the most pressing issues facing the local community. So that was really exciting to me.
You know, it's interesting because, as I said, I do radio now in over 100 markets across the country, and I deal with a lot of insurance carriers. This is not the norm.
No.
I mean, for Blue KC to make this kind of a commitment for this community, because that really is what this is about. Mm-hmm. This is about this community, all the communities that I just named, mm-hmm. all the Kansas City Metro, all the communities that they serve, whether it's Trenton or Sedalia or whether it's St. Joe or whether it's Clinton, Harrisonville, it doesn't matter. This is unique, is it not?
It is, but I think that, as I mentioned earlier, Blue KC has had many, many years of having a deep commitment to the community. We see ourselves as the Kansas City community. So when we think about our efforts and our health promotion strategies, we're really about impacting and improving the health of our community. And so in many ways, at first glance, it might seem odd, but I think that it's been clear to me since joining that there is a long-term commitment to this effort.
A long-term commitment and a philosophy that it is not this is not a sprint, this is a marathon, is it not?
Absolutely. And I think that, just even the commitment to a new strategy in health promotion and allocating resources to impact our children and families, I think speaks to, it aligns clearly with our mission, but it also speaks to being innovative and being a leader in this field, and that's what we're about.
And that's what you're doing.
Mm-hmm.
This is about as innovative as you can get. Mm-hmm. I mean, it's really kind of interesting, as Mark Dawnavan said, this is being mimicked now by other NFL teams across the country. Do you see other health carriers, other blue plans that are going to that or have looked at this or are looking at this and may in fact want to take it to their cities and their communities?
That's an interesting point. I think as Mark mentioned, this still is something that's relatively new. but I think people have, from a Blues perspective, are looking at this as a potential model, and I'm sure there would be potential interest of other Blue plans nationally to get linked up with efforts like this.
Yeah, and it seems to me that this is going to be 37,000 children through here. This has been open, 2 years now?
Not even
maybe? Not 2 years, not even complete, and 3,600 so far this year.
Absolutely. So what's interesting is that we're working very closely with the chiefs to support local schools to get to the lab. And so we have worked with many school districts in the area to help support their trip here, because we know the importance of getting kids through this and having this experience.
Yeah, and once you get them through here and once they have the experience, it's funny, Mark Dawnavan said the same thing you did. That the idea here is not just to be one and done and get out of here. The idea here is to take it back to their classmates, back to their families, to make an impact, to make it an impactful experience that's going to get them to think about these things and look at things in a different way, in a different perspective. You must feel pretty good about this. You must feel good about the fact that you've had 37,000. I mean, did you really expect to get that kind of participation with this? Because it surprises me.
Well, I think that both Blue KC and the Chiefs are delighted about the response. I will also say that, I can't tell you how many letters and emails of appreciation we receive back from schools that really say, this was amazing, that it was an amazing experience, and we appreciate your support in getting us there. And so I really do think that people go away with much more than just learning about the lab, but being appreciative of the support to get here.
Thank you, Dr. Davis. Thanks for doing this today. It is the Chief Sports Lab powered by Blue KC. If you want information on it, you want your club, you want your school, you want your YMCA, whatever the case may be, you want this opportunity. You've heard all these wonderful things today. This is a tremendous opportunity. It's a resource in your community. You should reach out and take advantage of this. Go to the website, goarrowhead.com, goarrowhead.com, click on tours, and you can get information about bringing your group here to the Sports Lab powered by Blue KC. Thank you for listening today, and remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting here on the HIA Radio Network, coast to coast across the USA. Goodbye, America.